Hi everyone, welcome to Face Facts. I'm Dr. Yusra. I see patients all the time who want to improve how they look and how they feel, and I get a request of reducing a double chin on a daily basis. So what is a double chin and why do you have it? Well, for most people, this is genetics, and it may be related to the position of your chin or your jaw. In some patients, genetically, they are born with a small mandible or an underdeveloped mandible, something called a retrognathic mandible or a retruded chin. This is where the chin is sitting horizontally in a back position or retruded position in the ideal position. Now, what this means is that the soft tissues that sit around the jaw are not supported. And if they're not supported, they can sag. This can contribute to the appearance of a double chin. And sometimes it isn't actually fat, it is just laxity of the tissues. And an improvement in the position of the chin, either through a treatment of a genioplasty, which is chin augmentation by a filler, dermal filler, or even an implant, can improve the issue. In other people, it may be related to weight gain, or they find that they never had it before, but when they put on weight, they start to see it. And this is because of an accumulation of fat called submental adiposity in the double chin area. And in other patients, they've had it their entire life. So you might have it even when you're skinny and tiny and have absolutely no extra weight on you, but you just genetically carry a little bit more subcutaneous fat in the double chin area. Subcutaneous fat is not the same as visceral fat. Visceral fat is the type of fat that lines the organs and that is amenable to exercise and diet. Subcutaneous fat is that pinchable fat that we get in the double chin area, sometimes around the arms, around the bra, and around the abdomen, or also known as muffin top, around the love handles. And it's the pinchable fat that sits just underneath the skin and is not that amenable to diet and exercise in the same way as visceral fat. And that's why we call it stubborn fat. In any case, no matter why you might have it, a double chin can affect self-esteem and it can have an impact on the facial appearance. So there's a number of different treatments that work. And today I'm going to talk to you about treatments that are proven to work and technologies that are dangerous and that you should not use. So number one, when it comes to a non-invasive treatment, one of the most commonly requested and performed treatments worldwide is CoolSculpting. This is a form of cryolipolysis. And in this procedure, the device, which is an applicator, sucks in the fat in the double chin area and freezes the fat to minus 11 degrees Celsius. It does this whilst keeping the skin healthy. So it doesn't actually kill the skin cells, but it does crystallize and kill the fat cells. And it usually reduces the fat in the area that it treats by up to 27%. In some patients, this means significant debulking of the area, and it's a no surgery, no downtime procedure. Now, what is CoolSculpting? CoolSculpting is a brand name now currently owned by a company called AbbVie, and it is the only FDA-regulated cryolipolysis machine worldwide. Now, there are many copycats out there, and I would say just be really careful about what treatment you are having done, because if it's not done professionally or safely, at best, it may not work. And at worst, it can actually cause skin necrosis and the need for a skin graft. So do not go cheap on this particular procedure. This is a procedure that will impact your face and neck area, and it is not worth cutting corners on. Now, here's the considerations. Multiple sessions might be needed, and this really does depend on the patient. And of course, results will vary person to person, but it is one of the most affordable procedures. There is no downtime associated with it, which means you can go straight back to work. You won't be particularly swollen, and the results will improve over a period of time. When you freeze the fat cells, what happens is the fat cells crystallize and then they leave the body because they undergo something called apoptosis, which is cell death. They then leave the body over the course of 3 months, and that's it. Once they're gone, they are gone. Fat removal is ultimately permanent, and if you sit at home and eat chips and biscuits and burgers and pizzas, you might put on weight, but what will happen is the remaining fat cells will expand, but you won't actually grow new fat cells. Now, CoolSculpting has been around for over 12 years. There have been over 10 million procedures performed worldwide, and the success rates are very, very high. But that doesn't mean that it is without risk. And the risks are important to understand. When you are freezing fat, the majority of the time, the fat dies and leaves the body, and there's no issue. But in some cases, some patients, for a reason unknown to us, can undergo something called paradoxical adipose hyperplasia, which means that the fat cells actually multiply. Now, in the unlikely circumstance that this does happen, the guarantee by the company that owns it to date, which is known as AbbVie, state that they will pay for liposuction for a patient that has PAH or paradoxical adipose hyperplasia. I'm lucky enough to state that I've never had a patient have this before, and I really hope that we won't ever have a patient that has this. And therefore, this is a treatment that I do recommend to my patients. We actually offer this treatment in all of our clinics. And it's a great, affordable treatment for those patients who want to significantly debulk fat without undergoing surgical intervention. The important thing to note about CoolSculpting is that because it freezes the fat cells, you will undergo a small period of time where the area will feel numb to touch. I'm going to share with you here some photos of some of our patients who had this treatment with significant impact. Because this is a medical treatment that involves permanent fat removal, please discuss this with a specialist in the field and ensure that you are going to a reputable clinic. And I would always say, check if the CoolSculpting device is real. Too often, I am seeing patients come in who have told me that they have had 100 pounds a pop, 200 pounds a pop, CoolSculpting, and actually it's a fraudulent device. It's a copycat device that does not have the same safety measures, which means that it is also ineffective. And ineffective is really probably the best possible way out of a fraudulent product because, again, at worst, it can cause permanent damage to the tissues. The thing to note about CoolSculpting is that the device has very sophisticated technology that constantly measures the temperature of the tissues so that it safeguards the patient against possible potential necrosis or damage to the skin and ensures that it is delivering 100% of the treatment each time. I've had this device in my clinic now for over 7 years, and we have had only success stories since then. And I think that this is one of the number one treatments to consider if you are considering fat reduction in this area and you want to debulk and reduce the volume of the area. But if you have a smaller double chin, maybe something that isn't relatively large, and you just want to fine tune, then there are other options that are non-surgical that are effective. One of them is called high intensity focus ultrasound. And there are different types of treatments or brands that offer this technology. And for me, the top two is either Ultherapy or Ultracell. Now, what these do is that they utilize micro-focused, highly focused beams of ultrasound energy to cause heat spots in the muscle and sometimes in the fat. And what this does is it can stimulate and tighten the muscle underneath the chin, collagen in the skin, in the double chin area, with particular mechanisms or devices that are sending heat to the skin to stimulate that collagen. And some devices target the fat, like the Ultracell Q+. Now, there are certain areas where we don't want fat reduction, like in the face. And in those areas, I would be really mindful about which high-intensity focus ultrasound device you're using, because some of them cannot differentiate between skin, muscle, and fat. And that means you can inadvertently lose fat. The Ultracell device is different in that it doesn't actually deliver the ultrasound energy in a linear fashion to the applicator. It comes out horizontally, and we can put a picture here for you to see. The beauty of that means that the heat spot and the heat being delivered is bypassing the fat and going straight into the muscle. So that's perfect for the face. But in the double chin, you can choose applicators that specifically target the fat. And what they do is completely different to CoolSculpting. They actually cause melting of the fat, emulsification of the fat, and they use heat to break down the fat. The beauty of this treatment is, again, it's non-invasive and there is no downtime. And you see a gradual improvement over months. But because it is a heat-based treatment, you might have some mild discomfort during the procedure. Nonetheless, it is a really effective treatment, and it can also help to improve the skin texture and firmness, and is a great, effective, and non-invasive treatment that is affordable for many, many patients. But I really usually keep these for patients who have very small double chin, who just want a little bit of refinement and who don't have a large bulk. If you have a large bulk, if you want a non-surgical option, I would consider either CoolSculpting or the next treatment, which is an injectable solution that can break down fat. Now, there are many different injectable solutions that can break down fat. One of them in the United Kingdom is known as Belkyra. In America, it's called Kybella. We also in the United Kingdom have Celluform, and we also have another one called Aculex. Now, what these do is that they are injected into the treatment area, so into the double chin, and they contain an ingredient called deoxycholic acid. And this is used to dissolve the fat cells under the chin. So it actually causes the fat cell to undergo apoptosis, which means cell death. And then they are permanently removed from the area, and they will go over time. Now, the benefit of this is that people do see a significant improvement, but the downside is you do usually need multiple sessions, and it can be very, very painful. The other thing to note is that this is not a no downtime procedure. It is an invasive procedure in that it is an injectable. It can be really, really painful and stingy to have done. There are risks of necrosis when you have a product that can dissolve fat into the area, and you tend to swell like a frog. So the swelling is no joke, and it is significant. Now, very few people only need one session. The vast majority of patients need 3 to 4 sessions about 4 weeks apart to see significant change with a deoxycholic acid injection. But it is effective and it is suitable for some patients, maybe not those who don't want any downtime, those who are looking for something a little bit more cost effective, and maybe not those who are concerned regarding discomfort or anyone knowing that they've had something. Because if you have had it done, you may need to hide for a little while behind a scarf to hide the swelling that is likely to come. Next up is probably our most popular, most demanded treatment, which is known as Endolift. Now, Endolift is an FDA-approved treatment. It is a laser-based procedure that can only be performed by medical professionals. That's a doctor or dental surgeon. And this procedure involves utilizing a micro-optical fiber, and this micro-optical fiber is inserted underneath the skin, and it's not painful because we numb you up completely, but when we place it underneath the skin, it delivers a true laser, which is approximately 1,500 nanometers, and this laser targets both water and fat, and it creates heat, and in doing so, it causes the fat cell to die. And you might have seen it online. It did go viral at one point, and you hear little popping underneath the skin, and that's the fat cells popping. Now, this can be combined with surgical liposuction where appropriate, or it can be done without liposuction, depending on the budgets that the patient has, the desired outcome that the patient wants, and also the volume of fat that the patient has. What this does is when the fat is emulsified or melted from the heat, it takes time to leave the body. So you will certainly not see any immediate effects with fat reduction because you need to wait for the lymphatics to get rid of the emulsified fat, which can take approximately 3 months, with maximum benefits being seen after 6 months. The beauty of the laser is that these settings can be controlled and it is very, very precise. So again, it's a fantastic treatment for those who want to fine tune. If they've got a little bit of a double chin, they want to fine tune, and they also want a little bit of collagen stimulation and tightening along the jawline. This is the perfect treatment that can stimulate collagen production at the same time as emulsifying fat. So it's a treatment I use a lot in my patients who are 35 and above, who have a little bit of laxity, some jowls, and double chin, who want to get an overall tightening and an overall sculpting effect. It's minimally invasive, but it is still invasive. There is some discomfort with giving you the local anesthetic, but otherwise it's completely pain-free during the procedure. And there is some downtime because it's more invasive, certainly, than CoolSculpting. So the downtime is something that you need to be aware of. Often after the procedure, I ask my patients to wear something called a face bra or a face strap, and this helps to minimize swelling in the area. And you need to wear this for about 3 days full time, and then every night thereafter for about 2 weeks. So you can go back to work, no problem. Great if you're working from home for the first 3 days. If you need to go to work, I do ask that you wear a face strap. This helps to just improve healing and optimize the results. You got to be patient because you're not going to see a result straight away, and there are risks associated with it. Because the nerves that you have in the face are surrounded by fat, and this treatment targets fat, it can cause emulsification of the fat around the nerve, and you can get temporary nerve irritation. So this is particularly important in the lower face, where we have a very important nerve called the marginal mandibular nerve. And the marginal mandibular nerve helps us to smile and move and animate the lower lip. Again, it's very, very rare, and thankfully it's not happened in my clinic to date, but it is something that can happen and is well documented. And if it does, it usually goes away in approximately 6 to 12 weeks. So it's something that you need to be mindful of and discuss with your clinician. The other thing is you will have some mild swelling and you might be numb to touch at the beginning, but it is a procedure that does usually give significant impacts to our patients, but it's something that you need to discuss with your clinician to see if it's right for you, because results can vary and it isn't suitable for all patients. Now, those are the main non-surgical procedures that we offer in clinic for fat reduction. But if you want something surgical, then you can add in liposuction. This is where we do surgical removal of fat deposits under the chin through a very small incision. Now, the benefits of this is there are immediate and significant results, but it may involve more potent anesthesia. There is a higher potential risk and usually a longer recovery time with more significant swelling, and certainly comes with higher costs. Lastly, if you want something dramatic, and if it's a procedure that is suitable for you, you have a lot of excess skin and fat, sometimes something that we call turkey neck, then a surgical procedure may be best for you. And it depends on your expectations and how much you're willing to pay. Now, a surgical procedure can remove excess skin and fat and provide a more defined neck and jawline. It is a procedure that needs to be done by a facial plastic surgeon and is a procedure that can yield fantastic results. It is comprehensive, it is long-lasting, it can be life-changing for many patients, but it is an invasive surgery that usually involves general anesthetic and has significant downtime and associated risks with having surgery. The most important thing when it comes to choosing the right treatment is going for a consultation and discussing options with a qualified medical professional to assess your individual needs and to determine the most suitable treatment for you. Make sure that the treatment that you have is personalized and tailored to the factors that are going to affect you, your budget, the degree of fat that you have, and the desired outcome. It is not one size fits all. And as with every single treatment plan, it's really important that this is highly personalized to your goals. But here's something that I would say you should never, ever do. And this is a treatment called lemon bottle. And I'm going to caveat why. Lemon bottle is a procedure that went viral last year on TikTok and Instagram and social media. And lots of people up and down the United Kingdom started to have this injected into their double chin and even into their bodies with the promise that this would remove fat. Now, unfortunately, this is not a regulated injectable. It has not been regulated or tested by the MHRA, which is the governing body for injectables. And in Switzerland, it has actually been banned after testing. Now, the reason why is because when Switzerland health authorities took lemon bottle off the shelves to test it, they found that there were multiple falsifications where at best the product didn't have what it said on the tin or only had one ingredient. In some cases, they found that lemon bottle only had caffeine in it. And in other cases, they found that the constituents and ingredients inside the lemon bottle actually had nothing to do with what it said on the ingredients list on the bottle. This is why it is actually illegal in Switzerland, but in the United Kingdom, unfortunately, we are not a well-regulated industry in aesthetics, and this has not been outlawed. And so at the moment, there is no robust clinical evidence to support its use. We are unsure of its safety or efficacy, and I would suggest extreme caution with having your body injected with something that has not been appropriately tested, where we are unsure of the safety mechanisms, the safety profile, and the risk profile. So please approach with caution. I do hope this has helped. If you've tried any of these techniques or treatments, or if you have any questions or you're thinking about having these treatments, then leave a comment below. I'd love to hear from you. If you've enjoyed this episode, don't forget to like and subscribe. If you want to hear more episodes like this, let me know. See you next time.